off so that we do not have any disruptions. For the purpose of Hansard, I'll be ensuring that only one person is speaking at a time. Welcome all. For the benefit of Hansard, could you please introduce yourself, including your title and how long you've been in post? Thank you.
Dr. Alex Allinson, Treasury Minister since 2022.
Sarah D'Oxel, Deputy Chief Financial Officer, and I've been in post for 22 months.
Thank you. I'd like to begin with kind of a broad assessment of where we are today. With only 9 months really remaining of this administration, perhaps slightly longer, how positive are you, Minister?
In what respect?
Just in terms of your role, in terms of where we are in terms of the economy.
The economy, okay, because I tend to be a positive person. I can be positive about lots of things. In terms of the economy in general, what I think we've seen, particularly over the last 5 years, is a remarkable resilience of the Isle of Man economy, considering the significant stresses that we've seen, both in terms of the pandemic, then the war in Ukraine and the knock-on effects there in terms of inflation. We're running at almost full employment. We're running also in terms of good economic growth. Looking at the last Statistics Isle of Man analysis, which was 22-23, it was 3.6%. Moody's forecast around about 2%. They downgraded it from 2.5% because of the UK economy outlook. But overall, the Isle of Man economy is doing very, very, very well. The question is how it can do better. And one of the aspects in terms of Treasury is to take that long-term view, which is why we'll be talking about 5-year financial plans. Although, as you say, we've got an election next year, the work of Treasury spans different administrations and has to, because what we need is a long-term plan, one to meet the needs of the population of the Isle of Man through expenditure, but also raise sufficient income to provide those frontline services and drive efficiencies as well. So looking at some of the parameters, you'll note that the economic dashboard, which is available online, shows good employment, stable benefit payments, but also increasing reserves there as well, which are very important as that cushion for any issues that may come up. I have to be honest though, we are trying to plan and have long-term plans at a time of almost unparalleled uncertainty and market volatility and geopolitical volatility. We've seen that really since 2019, 2020, where initially the Isle of Man government was very concerned by the knock-on effects of Brexit. And then we've seen since then a whole range of issues that have come, a lot of them external to the Isle of Man, but some of them internal as well, which have affected our projections and have affected our domestic economy as well. And unfortunately, those have not abated in some ways when you look at some of the political instability around the world, even the events in the French Parliament yesterday, you can see that there's a huge amount of uncertainty. And so one of the roles of government in general, but particularly Treasury, is to manage to instill confidence, both in terms of consumer and also economic confidence for those people who want to do business on or with the Isle of Man.
Thank you very much. In terms of one of the challenges which potentially has been absorbed into thinking, and we'd like to just spend a few moments considering the structural deficit. It did hit a peak during COVID, but for the past 4 years, it's been hanging around £100 million a year. In terms of that figure, is it a figure that does concern you? Is it something you believe we have to live with?
I disagree with your comment that it's hanging around at £100 million. Basically, the structural deficit, as you're aware, is the difference between income and expenditure. When we're looking at long-term planning for the Isle of Man finances and the provision of services to people in our community, there are lots of variables there, both in terms of income coming in, which has been positive and is encouraged by positive economic growth, but also overall government expenditure, some of which can be slightly outside of our control in terms of massive rises of inflation in terms of goods and services, but some of which is within our control. But what we've seen over the last couple of years is some issues in terms of particularly public sector pay, not having those long-term public sector pay policies, which I think from a Treasury perspective are essential for long-term financial management, and also looking at the overall expenditure on government services, particularly in terms of things like their headcount, which is why I think it's really applaudable that, you know, through the work of the Cabinet Office, we've got the overview of the public service workforce now being published quarterly, and we've got the operational performance and change board that was set up to really drive those efficiencies. But if I can hand over to Sarah Dioxel in terms of the structural deficit and how that's calculated, because I think, as I said, I would correct you in terms of your assessment of £100 million.
So the structural deficit is a plan, and it covers a 4 to 5 year period. But if there are changes to that plan and things don't happen, then it pushes the plan out by another year, which is why looking at the progress, it pushes the plan on another year, which is what you're seeing in the movement year on year compared to where we budgeted for. The structural deficit has seen challenges because of COVID, it's seen challenges because of cost of living and high inflation. It's seen challenges with healthcare spend, and all of those aspects impact the structural deficit calculation. Also, what impacts the structural deficit calculation is national insurance surplus and deficit. So depending on whether the impact on revenue funded benefits, so the state pension, what claimants actually apply for the Manx state pension and how that transitions across in the year affects the structural deficit calculation and can push it on. Ultimately, we're always planning to get our structural deficit position to a reduced amount, because essentially we don't want to be drawing down on our reserves forever. And whenever we're looking at our plan every year, it does change, but it changes because we're trying to readjust the plan to get back into a more positive position in that 5 year period. It is moving in the right direction. So the plan and the estimate numbers and the actual numbers are getting closer together after the period of the cost of living period that hit. So we're starting to stabilise a little bit more, and we're starting to. There is an element of prudency in there, which is reflected in our reserve numbers. So our reserve positions, the actual numbers are actually better than we project. So that helps to protect our reserves, and we're expecting that position to continue going forward. So we're expecting a position moving into, from the last financial year, we're expecting that position to be better than plan.
In terms of better than planned, when do you see us returning to surplus? Is that something that is on the cards, or are we just going to be talking about it going perhaps below 90 million?
It's reliant on a number of factors. So it's reliant on inflation remaining stable. It's reliant on income tax receipts and the economy still performing as it is currently. And it's reliant on healthcare spend being under control. All of those elements will adjust that structural deficit position if they're not managed. And what we're trying to do is manage that position every year to get back. But we're starting to see that structural deficit position reduce, and we expect that position to reduce going forward. So it is hopeful that it will get to a surplus position, but only time will tell. We are making some changes to the calculation for the next budget year to split the national insurance surplus and deficit out from the normal general revenue position, which will provide more transparency around what our structural position is for our general revenue for department spending and our structural deficit for national insurance, and to show that against those reserves that are related to that spend. So that will help to provide more clarity on both aspects going forward.
I mean, in terms of the structural deficit, as Sarah said, it's the balance between incomings and outgoings. We've obviously made significant changes in terms of the Pillar 2 corporation tax, which will be coming on board 2027 onwards. But in terms of expenditure in this year's budget, we got a total outgoing of close to 1.4 billion. When you look at the breakdown of that, health and social care is now the predominant expenditure from government at £387.4 million, and that surpassed social security benefits and payments at 366.5, which is predominantly pensions. We also, obviously, Tim Mulder has previously debated some of the internal demographic changes to the Isle of Man, which are driving some of these changes in terms of an ageing population and also increasing healthcare costs, partly due to that, partly also due to some of the other demographic changes we've been seeing. So there are lots of variables here, and what we are trying to do consistently in terms of Treasury is trying to balance those out and make sure that we have that long-term policy which can deliver long-term security. I think Mr. Wallenberg's previously been concerned with drawdown from reserves, and so am I. It's very important that we provide the right services within the budget we have, but don't use the gains from previous administrations to actually pay for that. What I would say is we've seen through prudent use of the reserves, but also investment income, a gradual growth of reserves now over the last 2 to 3 years, despite the structural deficit, and we aim to continue that. The question really is how we can do that once we get to, hopefully, a period of economic stability with the rest of the world, so we have that more stable inflationary environment, and also we can actually get in complete control of the government expenditure, particularly in terms of some of the costs we've seen driving workforce costs.
Thank you, Chair. Just 2 questions just to intervene as follow-up to some of the contributions made. It's been stated effectively that the projections are reliable in terms of the structural deficit and kind of bringing that back under control, or that it looks likely that they will improve. But Treasury must surely recognise that what has been projected in terms of the deficit reducing has consistently not been met over a number of years. So, for example, in the 21-22 financial plan, and that projected a structural surplus. But actually, for this year, 24-25, the most recent estimate for that year is a structural deficit of in excess of 91 million. So how reliable, really, can the projections be? Do you acknowledge that there's a gap between what is being projected in terms of reducing the structural deficit and the reality?
I think you're absolutely right. These are projections, and they're projections based on a degree of stability, both internal and external stability. I mean, in terms of 21-22, we were still facing the hangover from COVID and some of the COVID costs, and then we had a £10 million supplementary vote for DHSC, and then we went into 22-23 with really high levels of inflation, a whole range of cost of living schemes to help our community, and also some other stresses that were there. When you look at the overall trend, there is instability in terms of the amounts that we have to draw down on reserves from year to year, but what we're trying to do with the 5-year financial plan is balance those out. So the ambition is that once we return to a more stable economic environment, we can actually keep far more on track in terms of the reduction of the structural deficit.
Okay.
Yeah, I think the key thing is it's a plan. So and as plans do, they change over time. So what was expected and projected for 24-25 in 22-23 will be vastly different compared to what we're projecting last year, and that's because things have happened. So we've been finalising FIRSA. We didn't know where that would land, so there's a degree of provision in there, but until these things are settled, there is uncertainty there. And I think that's the case across all of the plans. There's elements, they are based on assumptions, they're a plan based on assumptions, and as those assumptions change, then the plan will have to change, and so that's why it moves over every year. Ultimately, in a stable period, that plan should be more accurate and reliable, but it does reflect the healthcare spend being under control and in line with budget. So every time there's a supplementary vote, that will impact the structural deficit position. If income tax receipts are higher than estimate, then that will affect the structural deficit calculation. But it's there for financial planning purposes, so that's why we have to move it every year depending on what the most accurate set of information and data we have is. Unfortunately, we've seen quite an unstable economy impacted by, as the Minister said, geopolitical issues and also the pandemic experiences that we've never had to go through before. And COVID, as an example, took quite a substantial sum out of our reserves, and then the cost of living increase then further put more strain and pressure onto those positions. But departments have had to readjust to get back to a sense of the new normal, and that's reflected in the you can see that through the plan changing over time. Ultimately, with inflation stabilising and hopefully continuing to subject to what happens elsewhere in the world, that will help to stabilise our structural deficit position.
Just my next brief question. Minister, you mentioned a pay policy. Obviously, pay policies cannot determine or limit actually what gets awarded or what may be negotiated. Sometimes, though, there would be a need to send a clear and firm message, and it's been done before. So my question to you is, why have you not considered announcing a cap on pay awards if, the pressures are such that they are potentially attributable to, the consistent expectation and possibility of negotiated pay awards arriving across the public service and in healthcare where they do? Why not announce a freeze on pay or a cap on pay awards?
Okay. So what I was saying previously was one of the problems with long-term forecasting, even short-term forecasting, is that in the past we've had 2 or 3 year pay negotiations and pay schedules. What we've seen particularly since 2020, 2021 is annual rounds of negotiations, which often have been completed the following financial year and then have had to be backdated, which makes long-term planning from a Treasury perspective extremely difficult, because you're accruing pay increases that actually aren't being paid during that year, and that has knock-on effects in terms of national insurance and also pension contributions as well. So I'd much rather get that sense of stability that the people working for the public sector know what their pay increases will be over a 2 to 3 year period. Treasury can then balance that and budget for that. That gives a much better ability for us to give forecasts in terms of public expenditure. The quantum of the increase, as you've said, is equally important. And I think we've seen, again, since 2020, various unions arguing for pay restoration, which is above and beyond inflation and above and beyond economic growth. And we've seen that in particular sectors such as the healthcare sector and education sector, which are dominant parts of our government expenditure. Often those negotiations are done with off-island unions, off-island organisations, and some of our pay grades are tied to agreements made in the United Kingdom. So it is difficult to have an across-the-board pay restraint or agreed formula for that. But I know that the PSC have been working on that recently to try to get a far more established mechanism for reasonable, fair pay awards, which can then be budgeted in terms of government expenditure.
But you must recognise that Treasury is literally the only part of government with the most clout to say that no more can be afforded and we have to set some kind of limit.
Treasury do have the ability, and have done that in the past. What we've been trying to do, though, I think consistently during the course of this administration is work with the public sector to drive efficiencies, drive better productivity, and reward those people for excelling at their jobs, which is the vast majority of people in the public sector. We're not at the point now of urging or mandating pay restraint, but we have to be cognizant that when you look at the overall figures of expenditure on the workforce, it is climbing year on year and consuming an increasing amount of overall government expenditure. But that undoubtedly, and we've seen from the quarterly reports, is being driven by increased remuneration and also increased employment, particularly within health and education and frontline services.
Also, we have essentially put a cap on to some extent by capping the amount of budget that departments are given. So irrespective of the pay award, the department's pay has been uplifted by 2%. So anything beyond that uplift to their budgets, they have to absorb. So there's incentive for departments to manage their pay costs within an amount that is affordable as part of the budget.
Just before we move further down this road, it's worth reflecting on your previous answer, which you made reference to an unstable economy before reflecting back on COVID and the historical nature of things. What were you meaning by an unstable economy, please?
An unstable economic environment. The economy of the Isle of Man, as I've said right from the outset, has been remarkably resilient. But the overall economic environment, whether that be interest rates, whether that be inflation rates, whether that be some of the extra costs that the Isle of Man has to deal with, have been increasingly volatile over the last couple of years. And the Isle of Man government has had to try to meet those, but both by obviously dealing with the day-to-day expenditure, but also looking at increased productivity and efficiency to manage and mitigate some of the significant increase we've seen, particularly in terms of energy costs.
Twice so far you've disputed the fact that we're hanging around £100 million in terms of the structural deficit, but the last 4 years, last year was 8.6 million below. The year prior to that it was £3 million above. The year before that it was 5.8 million below, and the year before that it was 4.5 million below. Now going forward, are we going to be actually going back over £100 million in terms of the challenges you've outlined in the past 10 minutes, in terms of pay, in terms of health, and in terms of the departmental spend? Is it realistic to actually say we're actually going to move away from that £100 million? Because you've previously suggested twice that we are moving away from that.
I think we are. When you look at some of the successes of this administration in terms of looking at spending, in terms of working with the individual departments, no doubt we'll get onto priority-based budgeting as well, in terms of limiting their spend, in terms of driving efficiencies, in terms of workforce. We are in a much better situation now, particularly in terms of the data we have in terms of individual departmental spends, than I think we've ever been. Also, Treasury have been involved in regular scrutiny panels with all the departments to actually analyse in real time their spending, rather than wait until the end of a quarter or the end of a financial year to then look at what has then become an overspend. So I think we're in a much better position to actually look at the amount of we're spending, but also again in terms of structural deficit, there is that need to drive income as well, which is why the Island Plan and the economic strategy are so important.
And just in terms of the data and the challenges, do you feel confident that moving forward that you actually have an accurate 5-year plan in place?
Well, as we've already said, it's an accurate projection at this point of time, but there are a lot of circumstances that can affect that projection going forward, particularly as you get beyond 2 to 3 to 4 and up to 5 years. One of the aspects that we've been grappling with, both in terms of Treasury but also other departments, particularly DOI, is the capital programme and the performance of that, and trying to drive investment in infrastructure at a time of very high unit costs, and also a contraction of the construction industry on the Isle of Man, which has made it incredibly difficult to go out for tender on certain small and larger projects. So that's why, unfortunately, we have underperformed in terms of the capital programme. I think we brought in the project development funding to try to get far better capital projections, but we're still working on that to make sure we can invest in the infrastructure in an affordable, reasonable and responsible manner.
But given the issues in terms of the spend on capital projects that aren't going through, how can we've got a situation where, as recently as 24-25 in the Pink Book, the structural deficit plan for this year was £24 million lower than the figure now budgeted for in the 2025-26 Pink Book? Why have we still got that kind of...
Sorry, could you repeat that?
Yeah, in terms of as recently as 24-25, the Pink Book, the structural deficit plan for this year was £24 million lower than the figure now budgeted in the 25-26 Pink Book.
So that's because the plan in the 24-25 Pink or the 25-26 Pink Book had to be readjusted to reflect experience and what was happening the previous year. So there's an element of projection in terms of where we think we will be, but as I mentioned before, when the plan hasn't actually been realised, it pushes that position out a further year. So that's what you're seeing across the years. So that's why it looks as though it's 24 million higher. But as we do the budget planning for this year, that figure will change, because 5 years is a long time to project out for, and things happen in the year which weren't realised. As I mentioned, the 24-25 budget will reflect a certain planned FIRSA position, and as we know, that didn't. That position was only finalised this year, so that will affect the plan moving forward as well.
So we're almost 6 months through this financial year. In terms of where we are we at the place you expect us to be?
Actually, in many ways, we're in a better position than we expected to be. We should be issuing the first quarter management accounts of this financial year this week, which show income coming in on target and certainly above target in certain areas, but also expenditure being controlled in a wide range of departments, although there are some significant risks in terms of particular departments, such as health and social care related to the mandate to Manx care. Again, when we're looking at some of the projections, I think we need to also be aware that it's not until we get the full audited government accounts that we can actually rationalise the exact amount we've needed to draw down from reserves, which is, I think, what the listeners are really concerned with in terms of some of the accounting procedures with Treasury. That's what we want to know, how much we're having to draw down on reserves and what the total reserve value is. And as I've said, the total reserve value has increased, and the amount we're drawing down on reserves in real terms has been getting under control and has been reducing.
And given the financial pressures from the pay in terms of health and other areas, you still feel confident we're heading in the right direction?
Absolutely.
So even though there is a pattern of the projections actually not being inaccurate, if someone was to put it to you that it's always a case of, jam tomorrow, it's always going to get better in the future, you'd reject that?
So in terms of the medium-term financial plan, looking at the structural deficit, that has been relatively accurate up until around about 2020. What we've seen is significant instability really since 2019 going forward, which has affected our ability to accurately forecast. I don't think that's an issue necessarily with the validation of the forecast. It's just the reality of the volatility and uncertainty in some of those long-term projections, such as interest rates, such as inflation rates, such as other costs. which are very difficult, both for Treasury and most economists around the world, to accurately forecast, particularly when you're going past 6 months.
Okay. Happy for me to move on?
Yeah, please. Thank you.
Okay, so the next set of questions will be around the use of reserves, and we've heard a lot already about sort of external pressures and about the need to try and plan for the unknown. You've mentioned that the use of reserves ought really to be a cushion against the unexpected. There has though been a long-standing reliance over a long period of time in government on using reserves really for business as usual, so to basically fund the normal operations of government departments, and this is acknowledged throughout the budget. But what are the plans to reduce this reliance on reserves in terms of them being used just as a matter of course for ordinary business?
Yeah, I think you're very right. You should, from a Treasury perspective, reserves, if they are to be used, should be used for investment, particularly in infrastructure, that can then give a return. We have, on the Isle of Man, been in the fortunate position of having significant reserves for a long period of time, but those have had to be drawn down on over the last couple of years, particularly in terms of some of the economic pressures that were faced with us, and we haven't got back to the situation necessarily of being able to put money back into those reserves. There are a couple of ways of doing that. One obviously is by generating interest on the reserves and then reinvesting that. The other is actually exceeding income over expenditure and being able to pay money back in. What we've seen recently by looking at the investment profile is we've managed to grow the reserves. The question is, we're in real terms, whether we can get back to the way reserves were before in 2018-19, and that's certainly our intention. It's important we have reserves. It's also really important, though, that we manage to finance government expenditure not at the expense of the local economy. So it's trying to get that balance right. But I'm fairly confident that with the plans we've got, we can stabilise reserves, which we have done, and then start building those up again in the near to medium term.
Also, what we have is a position where we've ring-fenced, so we ring-fenced 90 million in the Economic Strategy Fund, we've got ring-fenced funding in the Climate Change Fund, and draw down from those specific funds to help support the activities that they were designed to generate will also look like we're taking more from our internal funds, but they're one-off activities over the period of this administration to help support the initiatives of the Economic Strategy and the Island Plan and the Climate Change Act. So all of these drawdowns and activities that are being incurred in those areas will show as a drawdown from our internal funds. So it's expected that our internal fund drawdown will be at a certain level because we're spending from those funds that were designed for investment in those areas. What we did see over COVID and the cost of living was an increase in the drawdown from our more generic internal funds, which was contingency. And in the plan, we brought that estimate down quite substantially by about 50%, and it's remained at that across every year since the cost of living kind of pressures eased slightly. So that contingency funding has come down quite significantly, but some of the other funds have gone up a bit, such as the Economic Strategy Fund and the Climate Change Fund.
Okay, and where does the sort of, because a lot of the pressure will also just come from the ordinary cost of government, and whilst many people would think, absolutely reserves are there for those exceptional times, so there for a rainy day, where do serious efforts to reduce the cost of government come from, from a Treasury perspective, and how is that set out to departments?
I mean, in terms of at the macro level, what we set out quite blatantly in this year's budget was a 2% provision for any pay increases and a 1% increase for any non-pay increases. Now, when we've got inflation hovering between 2 and 3%, that means that all departments will need to look at the services and supplies that they issue and that they buy to drive efficiencies to stay within budget. Similarly, as we've previously outlined in terms of pay costs, if those are in excess of the 2%, they will expect to maintain that from their budget. So what we do right at the start of the year is look at the overall envelope for individual departments, work with them to make it quite clear that they need to prioritise their spend to stick within that budget, and then review that on a regular basis as we go through the financial year to make sure that they're adhering to that and they have the right support and advice to be able to do so. So by doing that, what I'm hoping we can do, and what we have been trying to do over the last couple of years since I've been in Treasury, is drive those efficiency and reduce at a time of what was quite high inflation the overall net real costs for providing those services to our community.
And how do you sort of see the situation between that delicate balance which exists with the island needing to live within its means, but also maintain a competitive tax environment? In addition, we've got a government that, in terms of the basic operations, seems to be costing more and not less. How do you square all of that off? Because the continued use of reserves, even though it's always hoped that they will be reduced, it is acknowledged that they are being used to fund ordinary government activity. How do you bring those things together to make sure that the island is going to be in a position of stability and strength and still have those reserves for a rainy day?
When you look at the overall budget for this year in terms of incomings, which were predominantly VAT, resident income tax, national insurance, but also company tax, the incomings were 1.38 billion, the outgoings were 1.38 billion. So in terms of day-to-day spend, we are living within our means. What that doesn't account for is some of the infrastructure investment. It doesn't account for some of the contingency funding that we have to provide to actually drive forward public services. But overall, we are managing a managed budget, albeit they're having to draw on reserves from time to time to meet some of the shortfalls. In terms of your comment about competitive environment, I think you're absolutely right. The Isle of Man has always tried to maintain competition in terms of being a relatively low tax jurisdiction, but also the ability to provide high quality public services to the people who live here. And that is always going to be a pressure point, particularly when you've got increased demands for things like education, healthcare, but also increased costs for those established services that people demand and expect. That's why we've been trying to look at a more progressive taxation system. We brought in some changes both to the rates of tax but also tax thresholds. We've looked at the tapering of the tax threshold for those people earning over £100,000. We've also been bringing in changes to corporation tax as well to make sure that we're not just taxing the workers and people working on the Isle of Man, we're also trying to share some of the considerable wealth and the growth in GDP that we've seen across the board. But we are living in a very competitive environment. We are dealing with some issues in terms of recruitment and retention across the private and public sector. And it's absolutely right that we try to create that entire package to make the Isle of Man an attractive place to remain, but also to move to if we're going to fill some of the skills gaps that we have and drive the economic growth that we need to succeed.
What do you mean by progressive?
But by progressive taxation system, what I mean is that those people earning more pay more into the tax system. And we've achieved that already in terms of some of the issues we've brought in over the last two budgets. In terms of a longer term taxation policy, again, the tax strategy that was received by Tim Wald is just up until 2026. What we need to do from next year onwards is look at some of the international changes to taxation that we've seen, particularly in terms of Pillar 2, but also some of the OECD changes in terms of personal taxation, and make sure that we remain competitive compared with other jurisdictions, particularly the United Kingdom, where we tend to attract most people from and where most of our residents, if they are going to leave the island, end up.
Do you not think things need to be more controlled, and that rather than go for a higher tax, sort of bigger government, that actually it needs to be quite the opposite?
I'm not saying we should drive taxes higher, and I'm certainly not saying we should have a bigger government. I think what we've seen in terms of this administration is a real concentration on the size and scope of government, trying to make absolutely certain that we have the right data and that we know where that spend is going. And as I've said, what's been evidenced is that some of the increase, particularly in terms of people and the costs of those people, has been in frontline services, particularly education and health. So I'm certainly not saying we should have a bigger government. I'm certainly not saying we should have a more expensive government. We need far more productive and efficient government, and we need a taxation system that rewards people for their endeavours on the Isle of Man and doesn't unnecessarily take income away from them.
How is this increase in tax take being assessed? Because in terms of the individuals you're looking at, they will receive the best financial advice, and they're the most mobile in terms of looking at the locations. So how are we actually doing it in a way that won't actually kill the golden goose?
I mean, I think there you're talking about perhaps high net worth individuals. If you're talking about that, I mean, when you look at the breakdown of people who earn on the Isle of Man, it is predominantly people of median income. It's predominantly of people on relatively modest incomes on the Isle of Man. And because of our national insurance and taxation system, they probably bear a disproportionate burden in terms of paying for the essential public services that they use. What we have seen, though, is by changing some of the parameters in terms of corporation tax and also tax for people who are earning over £100,000, we've had a more progressive system. When you look at the overall burden on people living on the Isle of Man, though, actually tax, national insurance is only one part of it. One of the increasing issues that Treasury are aware of, and I think most people are aware of, are other costs for living on the island, particularly housing costs. And that's why we need to look significantly at how we can provide adequate and affordable housing for people on the Isle of Man who are already here, because particularly on people on median incomes, that's a predominant part of their expenditure now.
And as our previous report did suggest, that it's those people with the medium incomes are actually not having the advantage of living here that they've traditionally had, and that concern is something that is being factored into your assessments going forward.
Indeed it is, because what we've seen is, particularly when we're comparing the Isle of Man with the adjacent Isle, they have had some quite significant changes to their national insurance rates under the last administration, which put us out of kilter with those. Similarly, whilst our taxation rates have remained relatively low, some of the changes in terms of allowances and other advantages for living in the United Kingdom need constant tracking. It'd be very interesting to see how their Chancellor responds to some of the significant financial pressures they are under when she gives her budget in November.
Just reflecting back on the actual spend and the income of the government that was referred to as being £1.38 billion. It was a reassuring answer in terms of things being in balance and not huge amounts of reserves being used at that moment. But the problem is with the use of the reserves, if you actually look at it as a cumulative figure over the past 5 years, we've actually taken out over £600 million from those reserves. And that is a significant sum. And in terms of what we've asked previously, in terms of the figure still being over £90 million a year, do you have concerns about that?
In terms of the drawdown on reserve?
Yeah.
Yeah, I absolutely, and that's why we have a medium-term financial plan which reduces that drawdown on reserves by controlling the structural deficit. When you talk about drawdown on reserves, though, you also need to look at the overall level of reserves, because that drawdown doesn't necessarily count for the interest that are created on those reserves, which can be compounded. So the latest figures we have is that in real terms our reserves are worth £1.96 billion at the moment. So that has increased since the COVID times. However, I agree with you that we need to constantly make sure that we're not drawing down on reserves and we're actually reinvesting some of that investment income for the benefit not only of the current population but also future populations.
Do you know how many millions have been taken from the pension reserve in the past sort of 8 years? And if not, can you provide that to the committee?
So you're talking about the public sector employee pension reserve?
And no, sort of thinking more about the resilience of the funds available for future generations to support their state pensions.
Is this national insurance fund?
Yeah, wherever that funding would come
There
from.
are two things that often get conflated. There's the public service pensions.
Mm-hmm.
There is no fund. There was a deliberate policy from the last administration not to have a fund, so that's taken out of general revenue. And then you've got the National Insurance Fund itself, which is provided to fund, obviously, social security benefits, some of those, predominantly also in terms of public state pensions, but also there's an NHS allocation from us as well, which goes to pay for the health service. So in terms of the overall amount of money taken out of the National Insurance Fund, as opposed to what's coming into the National Insurance Fund, both in terms of personal contributions, but also the correction from the United Kingdom, for those people who may have previously paid national insurance there are various charts in the budget which look at the amount coming in and out of the NI Fund overall. The NI Fund has been growing overall and is now over £1.1 billion.
But that NHS allocation is basically used to kind of, to basically fill a gap in a shortfall from overall government activity. And if you look at the figures, it sort of balances out, not just in respect of the NHS element.
Since the creation of the welfare state and the national insurance system, there has always been an allocation for the National Health Service coming out of that fund. So I would disagree with you that it's there to somehow plug a shortfall. It's always been there to contribute towards the National Health Service expenditure. What we've seen, though, is obviously that the growth in national insurance has not kept up with the growth in expenditure on the NHS, which has exceeded both in some ways inflation at times, but also economic growth of the Isle of Man. So it's looking at the overall balance of the amount of money we're spending on healthcare, which, as I've said, is now one of the most dominant expenditures of government. The contribution from the National Insurance Fund is relatively modest when you look at the overall expenditure on health, and certainly isn't there to plug any gaps, but is there as an inherent part of the funding system.
Okay, thank you. The next section is going to concentrate on a few questions to do with your Treasury's role in trying to control government spending overall. So the budget this year states that enhanced financial monitoring has been introduced. Can you tell us what exactly is that enhanced financial monitoring, and how do you expect it to result in reductions in spending? We'd particularly like to know, what are you asking from departments, and also how are you requiring them to report in on wastage, or how their funds are being used, and whether they're actually being used for public service benefit as opposed to just resourcing what might be considered bureaucratic activity.
Yeah. One of the first things we've done is actually publish quarterly management accounts, so that they're available both to the Public Accounts Committee but also to the general public, to show where we are in real terms during the year in terms of individual departmental spending, and also looking at the pressures they may have in terms of the various costs we've talked about. There's obviously also the Operational Performance and Change Board looking at driving efficiencies at a more council ministers and government level, but in terms of Treasury, what we've been doing is having regular scrutiny panels, interviewing individual departments on a regular basis, looking at their financial management, their financial accounts. I'll probably pass over to Sarah, who operates these.
So what we do is look at the management accounts that are produced. So we've as part of the scrutiny panel process, we have improved the timeliness of the generation of the management accounts. So that's one thing that's been beneficial. So we get all of the management accounts now on working day 13, and then those are reviewed by the scrutiny panel in advance of the monitoring sessions. Those monitoring sessions will look at some of the pressures or their overall position and what's driving their overall position, some of the risks that the departments are finding, and what mitigations they have in place to address them, and when the trigger point is for addressing those problems as well, and looking at the forecast. So what we will do as part of that process is we will rate those departments in terms of red, amber and green, depending on their risk of not achieving budget, their risk of not implementing mitigations, and we will then look at providing support if that's the case, and support can come from additional assistance and help with looking at their mitigation plans and their financial position. It can also come in the form of looking at what the next steps are for the department, so helping to soundboard as well with the department in terms of what they should look at next, and increasing that business partner support if required. So that's what's happening with the scrutiny panels at the moment. It was proved very beneficial last year. The departments all came in on budget apart from one, which was much better position than we've seen previously, and the departments have said that they appreciate the additional these scrutiny panels and the opportunity to support them through this process as well, because it is challenging. They are getting lower budget uplifts than what they're experiencing in inflation and increase to costs. So having the opportunity to speak with the panel and to go through those and provide measures and helping them to support with measures has proved to be quite beneficial. And they're continuing every month, so we report through to Treasury and Council and Ministers on the overall position every quarter.
And I think it's quite right that you're looking at expenditure and income as well, because sometimes people forget about the departmental income and updating that in terms of the overall costs of providing those services and making sure that's balanced.
It used to be the case a few years ago that departments would have to come to Treasury and explain why they wanted funding for particular capital expenditure or revenue projects, and essentially, make that case, make that pitch. And it was not something that actually, you would be aware that actually you would be under scrutiny for individual projects and departments. More recently, there's been a change to basically say, look, departments, it's up to you how you spend your money. Do you think that's working out correctly for public benefit and indeed, control?
I think what happened previously was that departments would come in with a whole range of revenue bids or capital bids which were above and beyond their usual expenditure, but often weren't time limited, were just adding on extras all the time. I think given the times that we've been through, it's absolutely right to say, look, we can afford a certain amount for your departmental spend. It's up to you if you want to do extra things that you therefore cut back on other aspects of your overall expenditure to afford those. And this was the start of far more priority-based budgeting with departments rather than them just adding on extra services and extra costs. So it was actually rationalising what their operation should be providing and doing it in the right manner within the budget that they were given. This was very much a response to some of the inflationary pressures we saw in 22-23. We will constantly review that, and we have asked departments this year to come forward with any particular things that they want to fund in an extra way which can meet the aspirations of the Ireland Plan and align with that. But it's also really important that rather than just add on cost year on year, we actually rationalise what departments are doing day to day.
Okay, and in the scrutiny panels, what does accountability look like for departments if they don't generate savings or they can't, explain properly where their funds are going for impact?
So a report is done to Treasury and to Council to inform them of the opinion and observations of the panel as part of their management accounts and the scrutiny panel process. So any concerns around the lack of mitigations to address risk, the lack of savings to help bring them back on budget, all of those things are included as part of the scrutiny panel report, which is then fed through, as I mentioned, to Treasury and to Council.
And then we have an honest discussion about the state of government finances, about the state of sometimes one or two particular departments and the pressures they're under, and we'll then make a collective decision in terms of how to necessarily deal with that while still keeping on track in terms of overall government policy.
And is there anything that you see that is a frustration for you as Treasury Minister that you think actually you really wish things could be brought into control in a greater way, or are you comfortable that the spending and the decisions are going in the right direction? The reason I ask is because it feels like Treasury is sort of, it's there as a helpful friend, it's there as an enabler, and I think that given that Treasury is the only thing that can protect what is public money, we don't often hear of any serious measures come out to bring those things under sort of control. So, what's your view?
So I take the role of Treasury being, without being cliche, the custodian of the public purse extremely seriously. The way we've tried to adopt the relationship with departments is very much working alongside them and trying to help and assist them in constructive ways. However, we have also said no numerous occasions and come down on departments who are either unrealistic in their spending programs, unrealistic in terms of what they want to spend money on, or are not performing and not raising enough revenue to meet their existing budgetary requirements. We've been trying to do that in a constructive way rather than a draconian way, but there is that responsibility on Treasury, as you've said, to make sure that all government departments are aligning to the budget that's been set by Tynwald at the end of the day. In terms of directly stepping into departments and ordering them to instigate particular mitigations, I think the use of the scrutiny panels and doing that month on month during the financial year has been successful in terms of getting some of the departments that were forecasting overspends back to balance. But it's common knowledge that we are having significant issues with particularly Manx Care and their spend at the moment, and are meeting quite regularly with the department and Manx Care to see what mitigations might be necessary to adjust their spending but still provide the services that people need. It is difficult. It keeps me awake at night. It is not easy.
And what do you think priority-based budgeting could look like in practice, and do you think it's possible, within the current structure of government?
Yeah, I mean, thank you for the question. I answered a Keys question to David Ashford back in November 2023 about the budget process and priority-based budgeting, and very much painted the picture as you have, that what we've been trying to do is setting the overall financial envelope available for departments, and then given them the flexibility to allocate their budgets against their priorities in line with the departmental plan and island plan. Further to that, though, what I said at the time was that we were looking at further work in terms of overall priority-based budgeting across government. And in July we went out for expressions of interest to get independent financial advice to come in to do that piece of work. We have started that now. That is a large bit of work. It's going into granular detail to every single department, looking at their expenditure lines, looking at what are statutory services, what are other services that they provide, trying to allocate exactly what budget is to each one, and then when we get the wider picture, talk both in terms of departmental but also across government what we can provide given the budget available, and what we should be increasing but also what we should be decreasing. And some of that may be looking at the statutory services that are currently provided. So the idea about priority-based budgeting, rather than just increase a department's budget year on year, is to actually go back really to basics in terms of their granular spend and look at the services that they're providing, interrogate that, make sure that we've got some consistency across all departments, but also look at where we can manage savings so that we can improve those services that really are important to people on the island.
And just in terms of priority-based budgeting, wasn't it tried during the previous administration with education? Was that something that was...
I think various departments have looked at trying to prioritise various parts of their spend. We've had an independent review in terms of the funding of education, the PAG review, but that was far more at a macro level, looking at overall secondary schools and overall primary schools. What priority-based budgeting has the ability to do is interrogate that far more down to a much lower level and look at why spends in one department might be above another department, trying to get some standardisation there, but also trying to make sure that those officers and politicians who are involved in the departments actually understand where their budget is being spent and understand also the control that they may have over that. I think it's all too easy unfortunately for individual departments to say, oh, we've had to spend more money on this because it's just happened, it's out of our control. I think there's always an element of control. Sometimes it's politically difficult, and sometimes it can, we quite constantly talk about making difficult decisions. They are there, but they can be made, as Ms. Lord-Brennan's already been talking about in terms of controlling pay. You can do things, you can deal with vacancies, you cannot fill posts, but that sometimes has a knock-on effect in terms of service provision. But I don't know, you were more au fait with priority-based budgeting than I am.
Yeah, I'm not aware of any attempt at priority-based budgeting in the previous administration, but I think there was a desire to do something in that space a while ago, a few years ago, and unfortunately events unfolded. I think that was over the COVID period, and that prevented the work being done on it. But that work, as the Minister has said, has commenced, and we expect to see the initial findings of that in a couple of months' time.
Yeah. And again, that's sometimes people talk about zero-based budgeting, priority-based budgeting. To me, they're similar, apart from in terms of public services, there are some mandated statutory obligations. So going back to zero is difficult unless you change the legislation that the various departments are working under.
So do you think, because it's, I appreciate there's a lot that goes into managing or even understanding all the financial aspects of government at an official level. From your perspective, is something like zero-based budgeting, if we absolutely needed to, and we said, look, we really need to bring things into order now for the sake of future generations and for the protection of reserves, do you think setting in place zero-based budgeting or priority-based budgeting is achievable within the current system of eight departments?
I think it's a challenge, but I think the first step is to really understand how much our services cost the public service, the public sector. So that's the piece of work that's being done at the moment, is to really understand what services we are delivering, at what standard they're being delivered at, and at what cost they're being delivered at. Once we have that as a starting position, then I think we can then look at how that interacts with the budget setting process. But the data is the challenge, and that's the piece of work that's going on at the moment, is to really get into the nuts and bolts of the data to actually really get an understanding of the costs of the services that we're delivering. I think once that's done, then looking at what departments have the ability to potentially alter is the next step. So what can you do within the existing service provision to look at altering the cost of those services, and what impact does that have on the provision?
And some of that data already exists, but it doesn't exist right across
I was going to say, is it hard to get a global view that if you needed to, you could say, right, that allocation would be simpler if there was a global view and a sort of a clearer point of reference rather than points of
just having to
reference.
go to each department and not being able to contrast and compare on the same way. And that's why to have a consistent way of priority-based budgeting, allocation and evaluation right across all departments, whether that be in infrastructure or health, and being able to see how people manage their budgets and how people manage their spending on the same basis is really important. Otherwise, I would agree with you that it's quite sometimes convenient for an individual department to say, oh, we're different. We're not the same as another department. We can't do that. In essence, what we're talking about is spending taxpayers' money. I think there has to be a consistency right across the field of all departments on that, and hopefully priority-based budgeting will give that overall view so that we can perhaps identify those areas where actually it should be the same, but it just isn't for whatever reason.
Thank you, Mr. Swanenberg.
Thank you. So I am a member of departments, and I know how tough it's been for my department with regards to pay in what you describe as a volatile economic climate. climate. So why would you think 2% is appropriate or adequate, particularly for a department that I am in, where a significant amount of that spend gets put onto pay? And inflation, we know what it's been like. So why do you think 2% is the number?
Yeah. I mean, in terms of Department of Home Affairs, I think close to or just over 90% of their overall expenditure is on people, because you provide frontline services. When we set out with this budget, one of the key issues was what the country could afford. Again, as we've said, that there's always departments who have statutory responsibilities, who have a larger proportion of staffing costs, and some of those staff are key trained professionals, often who are linked with various pay bodies on the adjacent aisle, and so our ability to control that that pay, sometimes at the same time as attracting and retaining those staff, is a struggle. However, by having an overall policy of 2% for pay, 1% for non-pay, what we've tried to do is really work with departments to see where their cost pressures are. That sometimes means that vacancies won't be filled. That sometimes means that people won't be replaced when they retire if those wage bills exceed that 2%. I think that is sensible, that is rational to bring that through. But what we've been doing with the scrutiny panels is where there's exceptional circumstances, for instance, where one department need extra revenue contingency or need the consideration of these pressures, that is built in at a very early stage in terms of the financial year, so we can forecast where those pressures might end up at the end of the financial year in terms of extra revenue expenditure, and then see how that can be offset by things like income generation or savings and efficiencies in other areas that perhaps don't directly affect the delivery of frontline services.
Okay. With respect, I don't believe you've answered my question.
Your initial question was, is it sensible?
Appropriate.
Is it appropriate? I think it is. You've got to start somewhere. You've got to have a common policy right across government in terms of what Treasury expects from the 1st of April. Various departments should be, what their budget should be in terms of dealing with some of these increases. In terms of the 2% for pay, 1% for non-pay, that is less than inflation. 1% is less than inflation, so we're looking at individual departments to make efficiencies, to make productivity savings. Absolutely.
Yeah. And the time will come where those savings will involve closures of fire stations, for example.
Mm-hmm. Not necessarily. Again, that comes down to the priority-based budgeting. So if fire stations are seen as the most, very important for the provision of services, and perhaps amalgamation of fire stations won't produce that same service level, looking at other ways of meeting those savings. Otherwise, we're just increasing government expenditure year on year with no decent evaluation of the services we're providing, whether they need to be provided in that way, whether they can be provided in other ways, whether they can be provided by other people. And obviously, fire and rescue is a very professional service, but looking at some of the fire stations around the island, we need to look at the geographical spread, we need to look at response times, we need to look at the best way of achieving the KPIs that are set out by the DHA of doing that. So analysing that, working with the professions involved is absolutely the right thing to do, rather than just cutting back on services when actually we can produce a more efficient service.
Okay, thank you. And just before I start my section, when you appeared before this committee some time ago, I specifically asked you, are you capable of making hard decisions? You recall that?
Unfortunately, I don't.
Okay. And you said you absolutely could make the hard decisions. Mm-hmm. So I ask you now, what hard decisions have you made and what benefits have they brought?
Okay. I mean, in terms of the hard decisions, again, I am a minister, but I'm also part of the Treasury board. I have other political members there and work with officers in Treasury and with the Council of Ministers. Some of the changes that I have wanted to brought through were not supported by the Treasury board, by the Council of Ministers. So I don't want to put over the impression that I alone can radically change things in terms of the Isle of Man government. But what we have been trying to do, and what I've been trying to do right the way through my tenure in Treasury, is to work with all government departments to drive those efficiencies, productivity, to understand what the cost pressures are, and actually make sure that we can start bringing individual departments back into budget at a time when 2 years ago we had going for supplementary votes. I think what we've done by being prudent, but also by being relatively hard with those departments, is in the last at the end of the last financial year, we only had one department that was over budget, which was Department of Health and Social Care because of Manx Care. So we have been working with various departments to make some difficult decisions. We've also been looking at the overall taxation regime on the Isle of Man, trying to make sure that we remain competitive. But that has led to some increases in costs for people on the island in terms of charges, but also in terms of taxation. But what I am keen on doing is when I leave my role in terms of Treasury next year, leave the Isle of Man economy and the Isle of Man finances in a much better state, but not at the expense of public services.
Okay, thank you. You just touched on health spend there. This next section is exactly on that. So looking now at the charts on the NHS allocation from page 15 of our paper onwards, we know that the budgeted NHS allocation for 25-26 has increased significantly. On page 8 of the 25-26 Pink Book, it stated that 6.3 million of this increase was due to a statistical revision, and the remaining 10 million is due to a policy change, raising the allocation from 19.3 to 24.8%. Could you explain this policy change?
Okay, there's two things there. As you say, it's detailed on page 8, and I also detailed it in my budget speech this year. When we were looking at the overall NHS allocation from national insurance payments, what we were trying to do is make it far more accurate. In the past, the forecasts have not been... The accuracy has sometimes been questionable, and what we've then had to do is, after that financial year, try to reallocate that. We've tried to bring in far more timely and better data so that we can get the allocation right. We've also looked at the last budget about reducing the upper rate of income tax from 22 to 21%, and so looked at the shortfall in terms of revenue going into the National Health Service through that, and so increased, as you say, the NHS allocation from national insurance payments that year from 19.3%, which it had been for some time, up to 24.8% for a set period of time. And that was a way of bridging that funding gap as we looked at overall healthcare spending and bringing it back into a far more balanced profile.
Do you think you've done that?
Well, we've made the changes in the budget. We've allocated historically large amounts of money to healthcare spending. The work we are doing with the department and with Manx Care is ongoing. I think they've been quite vocal in terms of their forecast overspend after the first quarter of the year. We are working with them closely to try to bring that into a manageable situation and understand some of the cost pressures that are facing healthcare. But as I said, I don't want to concentrate on Manx Care, but when you look at the overall government expenditure, it is now the dominant aspect of expenditure. It's also very important for people on the Isle of Man, not only that they see where the money is going, but they actually see the benefit of that extra revenue that's been provided by government. And they see that in terms of whether it's waiting lists or GP appointments or dental appointments, which is why we've been working very closely with the department and Minister Christian to try to make sure that she gets the right support she needs to drive the efficiencies and drive the increase provision of healthcare on the island, given the budget that has been allocated to her department.
Okay, thank you. It is important that you just mentioned that the public should see those efficiencies. Do you think they are?
I think there's been far more information being published now, vocalised, than possibly ever before in terms of the reports that are being produced, the briefings that are being given to the public in terms of expenditure, also in terms of the KPIs that are linked to various departmental plans and the island plan, and also the overview of the public service workforce and the quarterly reports on that, so that people can actually understand in a way that probably they've never done before in real time what this government is providing, how it's providing it, who it's providing it with, and how much it's costing.
Okay, thank you. What I can say as a constituency MHK, and I'm sure you can say it as well, public briefings are one thing, waiting lists are an entirely different thing, and dental waiting lists in particular. So I'm not sure that it's working.
I would agree with you. I think there's a big difference between perception and personal experience. And again, as a constituency MHK, I'm often struck by stories of people who have been in severe pain, in severe medical problems, have had a heart attack, have had a stroke, have experienced Manx care and the services of our healthcare providers, and have had absolutely brilliant service, have been treated very quickly, have been flown off the island, have had first-class care, and are very, very grateful for that. But that's contrasted with some people perhaps with chronic conditions who are on long waiting lists, people who are unable to access simple things such as a dentist, an NHS dentist, or get a GP appointment when they need one. And that's why in this year's mandate to Manx Care, the Health Minister made a significant push in terms of increased provision of community services, of the setting up of wellness hubs, of bringing care closer to people. And that's why there's been extra funding through the healthcare transformation for things like primary care at scale, to try to drive that provision of service so people can see the difference and see the benefit. But I would accept that sometimes the overall public perception is negative when it comes to healthcare. People do expect better, and they should do. I think it is a constant challenge to meet that expectation, but do that in an affordable way in terms of the overall government finances.
Thank you. Looking at page 30 of the 25-26 Pink Book, we can see that in large part, due to the increase of the NHS allocation, the deficit on NI operating account is budgeted to increase from 7 million in 24-25 to 23.8 million in 25-26. Is this a concern for the Treasury, especially in light of the 23 report by the UK Government Actuary, which said that our NI fund is set to be exhausted by 2048?
I mean, in terms of the overall pressures on the National Insurance Fund, those are very much dominated by pension payments and the current issues in terms of uprating. And obviously, Tim will have had several discussions about that. In terms of the rise in the NHS allocation, we've had similar work done to see if that would in any way destabilise the National Insurance Fund, and the answer is in the short term it won't. I mean, in terms of the overall drawdown from National Insurance, what I can say is that the Q1 results that we have show a higher than expected contribution for National Insurance, so some of that drawdown that we imagined is actually less than originally forecast. Again, often when you, as we've already said, when you're looking at forecasts, they are to do with that balance between income and expenditure, because we've seen a rise in income tax receipts and a rise in national insurance receipts. That has overcome some of the increased expenditure that we've planned for this. But we are monitoring this very closely and certainly looking at the long-term effects of any relatively short-term financial policies.
Anything to add?
No, the Minister described it. We've had the advice on it, and we've been advised that the impact is very small, and it's the longer term operating that is the concern for the long term in the National Insurance Fund.
If the NI operating account continues to run deficits, even while the overall fund in value grows, is this sustainable? Or is it effectively shifting healthcare funding pressures off the government's books and onto the NI fund?
Well, I mean, the NI fund is part of the government's book, so although it is ring-fenced for specific funding, particularly in terms of benefits and the NHS allocation, I mean, it's not part of the overall general reserves, which are there for things like revenue contingency and capital contingency. In terms of the drawdown and the deficit of the NI fund, perhaps you'd like to comment on that? I mean, what we've been trying to do is balance that. Again, part of that is some of the demographic shifts. We're also trying to balance through the economic strategy in terms of increasing the number of active working population that we have who directly contribute to the National Insurance Fund, but also looking at other national insurance reforms that may increase the funds going in as well.
Okay. Chair.
Thank you. Do you have any additional questions?
Just one final question from me, and actually it was something that a constituent asked of me on Saturday morning, so I'm going to put it to you. And they said, how are we going to go forwards? How can we afford to carry on without major changes?
Okay. Again, I think that from my point of view, I get approached by some people saying, we're bankrupt, aren't we? The answer is no. And again, we talked about positivity. We have a resilient economy, we have a lot of fantastic attributes here, we have reserves, but we are subject to very similar pressures to lots of different economies all around the world, and the added demographic pressures that have been identified by the Tynwald Committee as well. So it is trying to balance those. Also, we have to be cognizant of the fact that people on the Isle of Man have become used to and expect a relatively high level of public services, which spans a whole range of issues that wouldn't be available on the adjacent Isle. I don't disagree with that, but I think we need to be honest with people in terms of what we can afford, and we do need to make some changes as we go forward in terms of the size, the scope of government, the expense of government, and how much government intrudes on other people's lives. One of the questions you asked me was about taxation policy. When we did the tax strategy, I was quite clear that I didn't want to introduce wealth taxes such as inheritance tax, capital gains tax. I didn't want to tax more and more aspects of people's lives. I wanted to make sure that they paid a fair amount for the services that were being provided for them. And I think that's what we've desperately tried to do during this administration, despite all the challenges that have beset us. In terms of your constituent, what I'd say is that I think now, for the first time in many years, we've got the chance, through things like priority-based budgeting, by better data reporting, more transparency and openness and reporting to the public, to actually explain some of the changes we need to make, explain why we need to do them, and the benefits of doing them, and the issues of not making change. It's going to be difficult, but what I think we need to do is take the Isle of Man public along with us, rather than what we've seen in the past, which have been quite draconian cuts in services, and then trying to pick up the pieces years later when we've seen the damage that they've inflicted.
Okay, thank you.
Sorry, can I thank you? Just picking up on one thing you said there, is that we provide certain things that across do not, such as?
I mean, when you look at some of the statutory services that we have, whether they be from your own department in terms of fire prevention services, looking at fire control, looking at the link between building control and the fire and rescue service, examining buildings of multiple occupancy. There's a whole range of things that we do which are different. There are a range of different amounts of scrutiny that we instill through our public services, and a whole range of other services that we provide, which on the adjacent Isle may have been taken into the private sector, for instance, but we provide them through the public sector, sometimes at a cost. I think part of the issue with priority-based budgeting is to look at that, to actually see what the cost of services are, whether that's a fair cost, whether there should be a charge for some of those services, if that's relevant, but also what's the best way of providing those. And sometimes that is not government, that is the private sector, and so that's why that involvement with the private sector and that analysis of what we do, where we are treading on the toes of the private sector and stopping them growing, is really important for the evaluation of the role of government.
Could you give me any examples of that in the health service or not?
I mean, in terms of the health service, that's far more complicated, because what we haven't done is some of the reforms that were done in the United Kingdom, which then ended up actually creating more cost. For instance, the Public Finance Initiative in the United Kingdom, the idea of GP fund holding in the United Kingdom actually was, at the time, was seen as advantageous in terms of budgetary control. In the long term, added on extra costs and called extra complexity. I think there is the necessity to have a degree of simplicity. I know that the Operation and Performance and Change Board are looking at the various layers of bureaucracy we have, whether that's in the health service whether it's in other government departments, to try to reduce that and have simple lines of communication and simple lines of responsibility to make sure that the amount given to departments actually goes far more into the delivery of frontline services.
Thank you.
Are you happy?
I'm satisfied.
Mr. King, have you any questions?
No, thank you.
Brilliant. Thank you very much. We've reached the end, and that was